Home remedies for ear infections. Symptoms of an ear infection. Fluid and germs can become lodged in the outer, inner, or middle ear, resulting in a variety of ear infections and symptoms. Outer ear infections. Swimmer's ear is another name for an external ear infection. Bacteria can grow in the water that remains in your ear after swimming or bathing. This isn't usually a problem. However, a scratch or sore on your ear can cause a bacterial infection. Symptoms of a common outer ear infection. Redness on the outside of the ear. Itchiness. Congestion and ear pain. The discharge is yellow or yellow-green. Ear or neck swelling. Hearing loss or changes. Fever, normally between 100 and 104 degrees Fahrenheit. Inner ear infections. This ear infection, also known as labyrinthitis, occurs when your inner ear becomes swollen or irritated as a result of a cold, flu, allergies, or another condition such as meningitis. Symptoms of a common inner ear infection. Nausea, dizziness, and vomiting. Ear ache. Balance problems. Hearing loss or changes. Middle ear infections. Otitis media is the medical term for middle ear infections. They are the most common ear infection, particularly in children. Middle ear infections typically occur when the eustachian tubes, which connect your ears to your throat, become swollen as a result of a cold, flu, or allergies. When your eustachian tubes are healthy, they drain fluid from your middle ear. However, if they are swollen due to illness, the fluid cannot drain. Instead, the fluid collects behind your eardrum, increasing the likelihood of germs growing into an ear infection. Swollen adenoids, tissue lumps in the back of the nose, can also prevent ear fluid from draining. If the adenoids become enlarged or irritated, they can close the eustachian tubes. Symptoms of a middle ear infection. Ear ache. Fever, normally between 100 and 104 degrees Fahrenheit. Headaches. Fluid emanating from the ear. Hearing loss or changes. Balance problems. Throat ache. People can have middle ear infection symptoms such as hearing loss without actually having an infection. Inflammation and fluid buildup in the middle ear cause this. Hearing usually returns to normal after the fluid drains, which can take weeks. Learn about hearing tests and when you should get one. How to prevent ear infections. Ear infections usually occur following another illness caused by viruses or bacteria. Anything you can do to avoid getting sick or boost your immune system should help reduce your chances of getting an ear infection. Here are some tips for keeping yourself and your family healthy. Hands should be washed frequently. This helps to prevent the spread of germs that cause illness. Obtain a vaccination. Ensure that you and your child both receive a flu shot as well as other age-appropriate vaccinations. Vaccinations are one of the most effective ways to protect against viral and bacterial infections that can lead to ear infections. Avoid inhaling cigarette smoke. Secondhand smoke increases the likelihood that you or your child will develop an ear infection. So, don't smoke in the presence of your child. Better yet, talk to your doctor about quitting. Quitting smoking is one of the best things you can do for your own and your family's health. Limit the number of children around your child whenever possible. Your child will be exposed to fewer germs if they are exposed to fewer children. Breastfeed your child. Breast milk contains antibodies that boost the immune system of the baby, lowering the risk of ear infections. The American Academy of Pediatrics, AAP, recommends breastfeeding for at least 12 months and that baby eats nothing else for the first 6 months. Breastfeed your child. Breast milk contains antibodies that boost the immune system of the baby, lowering the risk of ear infections. The American Academy of Pediatrics, AAP, recommends breastfeeding for at least 12 months and that baby eats nothing else for the first 6 months. Hold your baby while they eat. Hold the baby in one arm and the bottle in the other if they are bottle feeding. Fluids can collect in the ear of a baby who eats lying down or falls asleep sucking on a bottle, increasing the risk of ear infection. Pacifier use should be limited. Pacifiers are recommended to help your baby sleep safely and reduce the risk of SIDS. The AAP, on the other hand, recommends discontinuing use of the pacifier around 6 months. Babies who continue to use pacifiers after 12 months are more likely to develop ear infections. The following are the most effective ways to treat an ear infection. When should you use home remedies and antibiotics? Ear infections are unpleasant for everyone. If you or your child contracts one, all you want is for the symptoms to go away as soon as possible. The best treatments differ depending on whether your ear infection is in the inner, middle, or outer ear. Ear infections can also have a variety of causes, including bacteria or viruses. So, what's the best way to get rid of an ear infection quickly? Do you think you should see a doctor? Or is it possible to treat an ear infection at home? Ear infections can be treated at home. Most ear infections resolve without the need for medical attention or special medications. If you or your child gets an ear infection, the first step is to treat the symptoms at home. Here are some options to consider. An ear infection can be treated with a warm compress. Ear pain can be relieved with a warm compress. Simply soak a washcloth in warm water, wring it out, and place it against the infected ear for up to 20 minutes. Reapply the compress throughout the day if it appears to help with the pain. Rest. Sleeping and resting strengthens the immune system and assists the body in fighting infections and other illnesses. However, sleeping on an infected ear is not recommended, and not just because it is uncomfortable. If you're an adult with a middle ear infection, elevating the affected ear allows the infection to drain more easily. So, if you're sleeping on your back, sleep on your other side or tuck a few extra pillows under your head. Keep blankets and hair away from your ear if you have an outer ear infection. The airflow in your ear can keep it dry, allowing it to heal more quickly. Gargle with salt water. Salt water is well known for its ability to reduce inflammation. And salt water may help with an ear infection as well, just don't put it directly in your ear instead. Add 1 teaspoon salt to 1 cup of warm water and gargle it for a couple minutes. If your ear infection is related to a swollen throat, this can help reduce your symptoms. Drying eardrops for an ear infection. If you or your child has an outer ear infection, commonly known as swimmer's ear, using fluid drying eardrops might help. You can buy OTC eardrops for swimmer's ear at retail stores and online. Using fluid drying eardrops is not appropriate for people who have ear tubes. They also shouldn't be used if there's discharge coming from your ear or if your eardrum is ruptured. So before using eardrops for you or your child's ear infection, it's a good idea to check with your doctor to make sure they're safe to use. Hydrogen peroxide. There's a chance that putting hydrogen peroxide in your ears could help with an ear infection. To try it, place a few drops of hydrogen peroxide in your affected ear, let it sit for a few minutes, then tilt your head over a sink to let the fluid drain out before rinsing off your ear. Talk to your doctor. If you or your child have frequent ear infections, 3 in 6 months or 4 within a year, ask your doctor if ear tubes might be a good option. If it's only been a couple of days and the only symptom has been ear pain, you don't need to head to the doctor right away. Because many ear infections go away on their own, it's likely your doctor will want to wait and see how the symptoms improve before providing prescription medicines. In the meantime, focus on getting lots of rest. Sleeping strengthens the immune system and helps the body fight off infections and other sickness. If the ear infection is causing pain or discomfort, there are treatments for ear infections you can try at home. One of the simplest is using a warm compress to dull the pain. Just soak a washcloth in warm water, wring out the excess water and then hold it against the infected ear for up to 20 minutes. If it helps, reapply the compress throughout the day. Thanks a lot.